How to relieve discomfort and improve posture while sleeping. For many of us, sleep is as important as food and drink. Food and exercise are great options in the pursuit of health. And sleep is what gives us nourishment for the mind and body. During the day, we should struggle with everyday stresses and enjoy time to relax. However, often, even when we want to sleep, we are deprived of the organizing abilities of our body that appear in every position. Discomfort makes our sleep poor. Posture is one of the most important elements when it comes to quality sleep. Even if we have previously provided ourselves with optimal sleeping conditions, adopting the right posture during sleep will allow us to achieve a much better state of rest. In addition, sleeping posture prevents long-term pain in various parts of the body. Proper and comfortable sleep is essential for physical and mental health. When we are sufficiently rested, it is easier for us to perform daily tasks and cope with basic challenges. It is important to choose a position that is comfortable. Most often, if we lie on our back, long organs, such as the stomach, force us to change position. The side position is probably the best choice for most people. Lying on the left side is recommended. When we are in this position, the pressure is evenly distributed. If this position is too difficult to achieve or maintain, you can try lying on your stomach with a pillow under your hips and lower back. Poor body position can have a very detrimental effect on our sleep and health. When we try to settle into an uncomfortable position, we need extra cushioning to ensure comfort. We avoid unhealthy symptoms such as back pain, spinal problems or muscle spasms by using a body support system that will allow us to better position ourselves. If you are dealing with muscle pain, it is worth trying to choose a position that will allow the muscles to relax. Thick mattresses and shaped pillows provide a better basis for positioning the body and keeping it in the right position. You can also choose a mattress and profiled pillows that perfectly adapt to the shape of the body and provide us with the highest level of comfort. It is also necessary to follow healthy sleep rules. Avoiding alcohol, avoiding coffee and strong tea in the afternoon, and avoiding both physical and intellectual exertion 2 to 3 hours before going to bed. Most of these lifestyle changes offer us effective and long-term support for our sleep quality. With all of the above tips in mind, there are a few things you can try to help ease discomfort and improve your sleeping posture. It is also worth remembering that we should save time for a comfortable and healthy sleep. Outbreaks of mysterious hepatitis in children. What causes the disease? In April last year, Japan reported the first probable case of acute hepatitis in a child, following a surge in cases in the United States and Europe. The mysterious disease mainly affects children under 10 years of age. In April 2022, the World Health Organization reported 169 cases of liver damage in children aged 1 month to 16 years. At least one death has also been reported. Cases reported in UK, 114, Spain, 13, Israel, 12, USA, 9, Denmark, 6, Ireland, less than 5, Netherlands, 4, Italy, 4, Norway, 2, France, 2, Romania, 1, and Belgium, 1. 10 children in the UK needed a liver transplant, and another case of a mysterious disease was reported in China. Research around the world is emerging as a likely cause of this type of hepatitis. Information gathered from our research suggests that the increase in hepatitis in children is related to adenovirus infection, says Dr. Meera Chand of the UK's Health Safety Agency, AUQj0. We are also thoroughly investigating other potential causes, he added. According to WHO data, adenoviruses have been detected in at least 74 affected children. Adenovirus F-type 41 was identified in 18 of them. This type has never been associated with liver damage before. In the UK, where most cases have occurred so far, adenoviruses have been detected in 75% of cases. Examined children, 16% of them also tested positive for COVID-19. The UKHSA stresses that COVID-19 was common at the time, so this was not unexpected. Although adenoviruses, and in particular adenovirus F-type 41, are considered the likely cause of the mysterious disease, it is still unknown what mechanism is responsible for its development. According to Professor Will Irving of the University of Nottingham, this type is associated with gastroenteritis in young children, but has not previously been associated with liver damage seen in recent months. The relationship between the disease and adenovirus infection is a possible hypothesis, but not yet proven, says Professor Irving. In the scientific literature, there are not many case reports of adenoviral infection associated with hepatitis in immunocompetent children or adults. So if it turns out that an adenovirus infection is the cause of this epidemic, it will be necessary to explain what has changed so much in 2022, argues Professor Irving. While adenovirus F-type 41 appears to be the likely culprit, the WHO stresses that more information on patients and their contacts is needed before drawing any final conclusions. One possibility being considered is that the lack of contact between children due to COVID-19 restrictions contributed to the reduction of immunity in the youngest and thus allowed the development of the new disease. Adenoviruses usually cause the common cold in adults, but also diarrhea, abdominal pain and vomiting. Occasionally, symptoms can be more severe and rarely cause hepatitis, says hepatologist Simon Taylor Robinson of Imperial College London. He adds, adenoviruses are not uncommon in the spring, considering the seasonality of adenovirus infections. Perhaps in the last 2 years children have isolated themselves from their peers, so they did not fall ill with typical childhood viral diseases that build immunity. So current exposure to adenoviruses may account for more severe symptoms in some of these longer-term self-isolating children, Taylor Robinson said. The number of cases of the disease remains low, but the UKHSA argues that carers of children should be aware of the risks. Parents should be alert to signs of hepatitis, including jaundice, and contact a doctor if any worrying symptoms occur. Usual hygiene measures, such as thorough hand washing and respiratory hygiene, help reduce the spread of many common infections, including adenoviruses, says Dr. Chand. Children with symptoms of gastrointestinal infection, including vomiting and diarrhea, should stay at home and not return to school or kindergarten until 48 hours after their symptoms have resolved. The WHO also emphasized that, contrary to speculations appearing on the web, no link has been found between the mysterious disease and vaccinations against COVID-19. The case has nothing to do with the coronavirus vaccine. No sick child under 10 in the UK is known to have been vaccinated.